Since the Affordable Care Act was put into place, the number of Americans with health insurance is higher than ever before. New statistics from the U.S. Census Bureau show the uninsured rate in Oklahoma dropped 2% between 2013 and 2014, but other states experienced even more dramatic declines. Some analysts believe poverty and Oklahoma's refusal to accept federal Medicaid dollars are preventing people from being able to access health care.
Before the Affordable Care Act was implemented in 2013, health insurance was out of reach for many Americans. Private insurance was just too costly. But according to newly released data, the tide is starting to change.
The Department of Health and Human Services tells us that almost 12 million people signed up for coverage in the most recent open enrollment period and the special enrollment periods that followed in both the federal and the state marketplaces. A 50% increase over the first year.
Susan Denser, a senior health policy advisor for the respected Robert Wood Johnson Foundation, recently assessed the pros and cons of the Affordable Care Act before hundreds of health professionals in Tulsa.
Again, in those states that have expanded Medicaid, and I don't need to tell you, this is not one of them, we have had a very dramatic growth in Medicaid enrollment. So the bottom line overall is as many as 25 million people are now covered under some aspect of the law.
New statistics from the U.S. Census Bureau show more Oklahomans do have health insurance. The uninsured rate in Oklahoma fell from 17.7% to 15.4%. Gene Perry with the Oklahoma Policy Institute has analyzed the recent figures.
This year it improved a little bit as far as the total rate in Oklahoma, but we still are trailing behind most other states, and even our improvement is far lower than the states where they've accepted Medicaid expansion.
31 states have now accepted federal dollars for Medicaid expansion, and several others plan to take advantage of the federal offer this coming year or are considering it. There has been no discussion of changing course in Oklahoma. Governor Mary Fallin continues to refuse the federal money, saying the alliance with the federal government would force the state to increase state spending on Medicaid by 2.7%. But Perry says the state share would be modest compared to what it would receive from the feds.
So the latest estimate is that the accepting federal funds would bring more than $8.5 billion into Oklahoma over 10 years. And that translates to $2.3 million per day. So it's a really substantial amount.
Perry says that money would go a long way in helping the 580,000 Oklahomans who remain uninsured. Many of them are the working poor, like those who tried to sign up for insurance with the help of navigators, only to find they didn't qualify.
But we have had a lot of folks who came here who wanted insurance who are below the poverty level. And if you're below the poverty level in Oklahoma, you don't get assistance in paying for the insurance.
2 years ago, ONR met with Tulsan Lynn Endries, who was underemployed and seeking health insurance through the government exchange. She, like many Americans, experienced glitches trying to access the exchange. But Lynn finally found a health insurance policy she could afford. The government subsidy allowed her to get a rate of $83 a month, but the deductible was $2,500.
So I still didn't go to the doctors. I still didn't use my health care because of the deductible.
The next year, she got a policy with only a $500 deductible.
My eye drops that I'm on, that I have to take forever, under the old policy, I had to pay anywhere from $40 to $350 for the eye drops. Under this new policy, the one eye drop that I take all the time is free to me. So I love this policy. I would like to be able to keep it, but...
With rates and co-pays expected to go up, Lynn believes health insurance may be financially impossible for her to keep next year. So while the Affordable Care Act has helped many, it is not providing a safety net for the working poor. In Oklahoma, the poverty rate has not improved. 1 out of 6 people, or 16.6%, are making less than the poverty line of $24,000 for a family of 4.